Greetings. My name is Deborah King, and I am happy to talk with you today about my near-death experience, which was my exceptional human experience that occurred in 2008. There were several spiritual experiences that occurred in my life from the time I was a young child that led up to this experience. And I think they're important to just talk about a little bit so that you can get an idea of what these were and the role that they played in my life. The first was in 1962. I was a little girl, and I had a situation where I was walking home from school, which was very common in those days. And I was approached by a car with a stranger in the car. And I was overcome with the strong intuitive knowledge that I was in serious danger. And at the time of that intuitive knowing, I literally felt what felt like somebody pull me from the scruff of the neck away from the car. And I turned around expecting to see one of my neighbors or somebody in the community getting me out of the way, and there was actually nobody there. I am absolutely convinced that this experience, this intuitive knowing, saved me from a near abduction and possibly worse, which of course we didn't really talk about much at that time. And I had no way of really even understanding that that was something that could happen to me. So I certainly didn't understand that with my knowledge, but my soul, my intuition on some level understood that. In 1972, I had what I now know was an out of body experience. I did not know that at the time. I was a senior in high school. I was a passenger in my father's car, and we were waiting at a red light for the light to turn green. And that's the last thing I remember. We were hit broadside by a drunk driver who was running the light. And the very first thing I remember after sitting in the car waiting for the light to turn green was being out of my body and looking down at the wreck and seeing my body there. And I couldn't really make sense of this. I really didn't understand. I thought I was dreaming. I knew I wasn't. I could see my father. I could see him. Um, he had minor injuries, but he was able to get himself out of the car. People were coming to assist. It was a horrific accident scene. I felt no fear or no pain at all and wanted to tell my father I was okay. I actually felt compassion for my father, who was frantically running around despite his injuries, trying to get me out of the car. Of course, he couldn't. And I was unable to reach him. And as soon as I saw the rescue squad arrive and try to extricate me from the car, that quick, I was back in my body. I regained consciousness, opened my eyes, was aware that I was bleeding, was covered in glass. I had severe orthopedic injuries. But that was an experience that stayed with me for a long time. The out of body experience, I really didn't understand it. There was no context that I had to put this into. And then in 1977, I was a witness to a patient of mine when I was an ICU nurse at Johns Hopkins who had a sudden cardiac arrest and had a veridical near-death experience. And by that, I mean he had a near-death experience during his cardiac arrest that was able to be verified. It was veridical. He was able to tell me exactly what happened during his resuscitation, where I was standing, the words that I said to the resuscitation team, who was present, what they looked like, where I was standing, what the anesthesiologist looked like, the trouble we were having intubating him, the blood that was present on the trauma resident's shirt. He had just come from a trauma resuscitation. And these were details that only somebody who was in that room would have ever known. And he said, well, nurse, I saw the entire thing and I was watching it from right up there in the corner of the room. And he pointed to the cardiac monitors. And he also told me that they wanted to call the resuscitation. He was not doing well. We were working on him for quite a long period of time. And an intuitive knowing came over me again that said to me, we have to keep going. If we keep going, we will save this man's life. And there was no medical reason for that. There were no indicators that told me as a nurse that we were going to get this man back. But I felt it come over me. And as soon as I felt it, it came right out of my mouth. And I said to the resident, let's go one more round. And he said, oh, okay, Deb, let's go one more round, which really was a term that we used that referred to a round of resuscitation drugs and interventions that we would do sequentially for somebody who was in cardiac arrest to try to get them back. This patient told me that I said that. He actually said they wanted to give up on me. And I heard you say, let's go one more round. In my day, nurse, that meant that it was last call at the bar and people wanted to go one more round. And he kind of chuckled. He said, thank you. Thank you for saying that. You saved my life. I remember freezing in place. The words that come to mind from that time, and I'm kind of even getting the chills when I tell you about it, were this changes everything. This changes everything. I could not make sense out of this. How was this patient who was in full cardiac arrest able to tell me these details? This really set up a strong desire in my life to learn more about these experiences. Well, what were the commonalities in my life for these three experiences? They were all anomalous ways of knowing, very similar to what is described as an exceptional human experience. They were certainly otherworldly. There was no scientific explanation, no physical evidence, nothing in the outside world that could explain what happened. They certainly were life-changing for me. And they shifted my worldview from the time I was very young to the time I was a young nurse in 1977. Things were never the same for me after those experiences. Although I couldn't understand them, had no context for them, I knew that they were very, very real and that they were important. And somehow I understood that they would someday play an important role in my life. They cultivated a growing interest for me in the paranormal and the supernatural, but I was unable to integrate this into my life or later into my clinical practice because I certainly didn't have the tools to do so. And as a result, I shared them with nobody. And I just kept these kind of under the vest and processed them alone for many years. Now, what does a near-death experience and an exceptional human experience have in common? Well, if I had to pick one word, I would say transformational. That kind of is really at the core of an exceptional human experience as well as my near-death experience. It was a profound event, subjective. An NDE happens when somebody is believed to be close to death or recovers from a serious injury or illness for which recovery is not anticipated. And somebody confronts a potentially fatal situation and they escape uninjured. In an exceptional human experience, which is also out of the ordinary, anomalous, and transformational, there are very, very many parallels. And the commonalities are that these are also out of the ordinary, anomalous, and transformational. And both of these events really incur and trigger a renewed sense of purpose in the life of the experiencer, which certainly was the case for me. And I'm going to talk a little bit about that later. So what was my NDE? How did it happen? Well, it happened on December 15th, 2008. And it occurred sometime during a sudden cardiac arrest, which I had out of the hospital. The statistics for survival with somebody being neurologically intact after this event, or being alive at all, are very grim. They're about 6 to 10% to even survive. I had no ischemic heart disease, no risk factors, no heart attack, no damage to my heart muscle. This was purely a sudden electrical event, as if somebody literally just pulled the plug. I was deeply grieving the loss of my father at the time, who had died 6 months prior to this event. And I actually had just come from visiting his grave. I had driven up to his gravesite. It was around the holidays. I wanted to be close to him. It was a very, very difficult first Christmas without him. And I came home with just heartache. I felt like my heart was breaking. And literally, that's really what it did, actually, in a physical way. Because after I entered the house, my husband said to me, you know, you really don't look good. You should probably go to bed early. To which I replied, okay, I think you're right. Uh, and he thought that was a little odd. And he kind of followed me upstairs and said he was just going to hang around and kind of be with me for a while. And I said, well, how do you expect me to feel? My heart is broken. And his intuition kept him with me. And had that not happened, had he not followed his own inner knowing, I would not be here speaking with you today, because 15 minutes after I made that comment, I was in full cardiac arrest. He knew CPR, and his ability to give me CPR was the first link in the chain of my survival. The interesting thing is that I had taught my husband CPR. I had taught everybody in my household CPR, not because I thought anything would ever happen to me, but because my husband himself and my father both had cardiac histories, and nobody was going to go down in my house without a fight. Never in my wildest dreams did I ever believe that they would use what I taught them to save my life. I had no risk factors for a sudden cardiac episode, sudden cardiac death. And yet I was the one that benefited from that teaching. So again, a very interesting synchronicity there, I believe. That year for me was probably the toughest year of my life. I describe it as having a tsunami of stress. My youngest son was disabled. He was going through a very rough period of time with his autism. My husband himself was having major medical problems and traveling a lot under a lot of enormous pressure at his job. He was a bank regulator, and he was dealing with a lot of bank closures in the financial crisis of 2008. And I was caring for my father, who was dying of pancreatic cancer. It was a very, very rough year. Trying also to care for my other three children. I have four. And keeping my professional life going somehow. The only person I really wasn't taking care of was myself. After my cardiac arrest, I was brought to the hospital, and I remained in a coma. I did not regain consciousness. This was not a good prognostic sign. And sometime during this coma and failure to regain any neurological response, I had my near-death experience. What did that look like for me? The first thing I remember is being in a black void, or a very expansive state. I didn't experience a tunnel like many describe, but I did feel that I was kind of floating in this black, expansive space, no boundaries. That was kind of soft and velvety and comforting. The striking thing is I felt absolutely no fear whatsoever. And the thought occurred to me that I was out of my body and that I might be dead. And I, what do all good nurses do when they want to do an assessment? They look for evidence. And I did the body check. I kind of laugh now when I think about it. I felt for my head, my arms, my body, my legs. Check, check, check. No body. I satisfied myself pretty quickly that I did not have a physical body and that I was, in fact, out of my body and probably dead. This did not frighten me. In fact, it amazed me. I remember thinking, wow, I'm not in my body, but I'm still me. I'm still me. And it was amazing to me. It was a sense of peace and wonder. And all I could think was, wow, what's going to happen next? As soon as I had that thought, I felt like I was being transported into what I describe as a web of living light energy or a spider web of light. And it really did look like a spider web, this intricate matrix of light that was suspended in space and beautiful. And I knew pretty quickly that I was a part of this. And not only was I a part of it, but I was an important part of it. I couldn't really understand that, but it was a wonderful knowing that I had. And there were definitely lights in this matrix that I recognized as souls, as living beings. I didn't see them in physical form. I saw their energy signature. That's the only way I can describe it. There was a kind of unique configuration of light energy that was as unique as a snowflake for each soul that I saw. Some of these I recognized as deceased relatives, and the others that I did not recognize, I somehow still felt that I knew. I wasn't sure where I knew them from, but I felt like I was coming home. I felt like I knew these souls from another time, like the familiar unknown is a way that I describe it. And I felt a sense of universal oneness and connection with all of them. It was really, really breathtaking. I had a life review, as many near death experiencers also describe. And the way I can describe this was almost like I was watching a PowerPoint, like we're going to be watching today with all of the speakers, a slideshow of my life. But these were scenes from my life that I would not expect to see. Many of them were not big events in my life or what I would consider highlights of my life. They were small, everyday occurrences that were shown to me where I felt and experienced what the other person that I was interacting with was feeling and experiencing. It's kind of like I was right in their soul. And this was very challenging for me at times and very, very moving. It is something I will never, ever forget. I also had another dimension to that life review where I saw souls that were unharmed by things that they had either done in their human life to other people or that other people had done to them. I was seeing, flashes of experience from their life in the same way I was shown mine. But the emphasis was not on their life review. The emphasis was on the message that was given to me, which was no matter what happened to these souls in their human existence, nothing could harm the souls. The soul is intact and immortal. I encountered my deceased father. In my experience, I was overjoyed to be reunited with him. He reassured me that he had never left me and that we would always be together, even if we were not together there or in human form, because he had transitioned from his earthly life, that we could never be separated. It was impossible for that to happen. I didn't quite understand this, but it was just so wonderful to hear from my father, and I trusted his words. He also encouraged me to go back and to do some very important work, which I really did not want to do. And this meshed with the second soul that I encountered, which actually was my ICU patient, the patient that I told you about just a few minutes ago that had the cardiac arrest when I was an ICU nurse way back in 1977 at Johns Hopkins. He actually appeared in my near death experience. I was so shocked and also delighted to see him. And he gave me a message and he told me that when that experience happened to me as a young nurse, that was not accidental. The reason that that happened was so that I would understand that not only was he telling me the truth at that point in time, which I knew from my car accident, I knew that somebody could be out of their body watching what was happening. So that was a parallel. But also because this experience could help many people, especially healthcare professionals, and that I was to return and to share this experience, which is actually one of the reasons I'm doing this talk today, and hopefully we'll do others. I was excited at the prospect of this assignment, but I soon realized that if I accepted this assignment, that it would have to return to my body. And I did not want to do this under any circumstances. I wanted to stay right where I was. There was a heightened understanding that I had of many, many things that were just kind of downloaded, just like that. And I understood things that were just complex in so many ways. And this mission to share that was given to me both by my father and my former ICU patient was something that I reluctantly embraced. And as soon as I agreed to return, which, side point, I was told that I had already agreed to do that. I didn't remember it, but at some other time, I had agreed to return, that this was some sort of a soul contract. I didn't really understand what that meant, but I accepted it. And as soon as I accepted it, I returned to my physical body. The return to my body after the out of body and near death experience was in and of itself an exceptional human experience. When I returned to my body, this was the first time that I was aware of being afraid. It's the first time I felt fear. I felt no fear outside of my body in that expansive space. But as soon as I was confined again into my physical body, I felt extremely confined. I was in a lot of pain. I was totally confused. I was very angry, actually. I wanted to kind of find that eject button, wherever that was, so I could push that button and return to where I was. I couldn't find it, and I became very, very frightened. What am I going to do now? I could hear and feel a lot of what was going on around me, even though I remained in a coma and on life support, which is very, very important, I think, for healthcare professionals to remember that even when patients are in coma, they have other ways of perceiving. My family was advised that my prognosis for recovery was extremely grim. And actually, my husband and sister and daughter were called to the bedside and were told that they should make arrangements because I was not going to make it. And if I did, I was not going to have a functioning brain. They asked my husband if I was an organ donor. This is how far things had progressed. And my family started actually making those arrangements. And in the middle of that, with no medical explanation, I woke up. I regained consciousness spontaneously, and I extubated myself. I actually pulled out my breathing tube. which was connected to the ventilator and other life support equipment, IVs, monitoring equipment, pulled it all out and sat up and opened my eyes and knew exactly where I was. I had no idea how I had gotten there. Actually, I was in an intensive care unit where I had worked as a nursing director in that facility. And I was extremely confused, wanted to go back, definitely wanted to go back. I couldn't go back, and my recovery was challenging. Took about 6 months to a year. I did incur an anoxic brain injury from a long period of time without oxygen. I had amnesia, both retrograde, so for events about 3 months prior to the event, I had no memory of those, and anterior grade amnesia. So going forward, I couldn't make new memories. This was really probably more frustrating for me than the retrograde amnesia. If any of you have ever seen the movie 50 First Dates, that was me for about 3 to 6 months. I could not make new memories. I couldn't tell you what I ate for breakfast that morning, but the memory of my near-death experience, despite what was happening physically to my brain and the tremendous insult that my brain had incurred, the memory of my near-death experience was completely intact. I had an expressive aphasia. I had trouble finding words. My emotions were all over the place. I felt very imbalanced. I kind of describe it as feeling seasick. I felt like I had one foot here in the physical world and one foot there, wherever there was. And I really felt imbalanced most days. It was kind of like I was in a parallel universe, and I felt connected to both parts of those universes. I was in rehab for quite a while. And after my neuropsych evaluation and all of my other indices returned to normal, completely normal, which was actually a shock to everybody on my medical team, I returned at that point to my therapy practice. I had some severe challenges, and this is where my knowing that I really needed help began. I was dealing with a very high risk caseload. I had seen many of these patients for years. Many of them had a high degree of suicidality, and they knew I had had a cardiac experience. They didn't really know the details. Part of that was disclosed to them. I was out on a medical leave, so they knew a little bit about it, but they really were very curious as to whether or not I had had a near-death experience. And they would directly ask me, Dr. King, did you have one of those experiences? We've heard it's a wonderful, peaceful place. Were you there? What was it like? Because, it's got to be better than here. And if that's the case, if you told me that that was true, I would believe you. Well, you can imagine the tremendous conflict that this set up for me. I knew many of these patients were struggling deeply and were at very high risk for taking their own life. And yet I wanted to be as authentic as possible as a therapist. So I had great difficulty with that because, of course, I didn't want to say anything to endorse taking one's own life. I mean, that's not why I was there. I was there to preserve life, to help them, to prevent a tragedy such as taking one's own life. And so I had great difficulty responding to those questions. I would refer them to the literature and I would kind of talk around it. But some of the clients that I saw long term, they knew me well enough to know that I wasn't really responding as genuinely or as authentically as I normally would have. And this set up a tremendous conflict for me. I really did not know how to process this. and deal with this, especially with high-risk clients. I had a very heightened sensitivity after this experience and empathy. It was really beyond empathy. It was very similar to what I experienced in my life review in my near-death experience, where a client would come into the office and I would feel empathetic towards them, as I would like to think I felt prior to my near death experience. But this was different. This was as if I was in their experience. I was actually feeling their emotions and feeling their experience in a way that was so exquisitely sensitive. At times, it was very difficult for me to find that balance and to set those really appropriate professional boundaries that we all have to set to help somebody and to maintain uh, the professional distance that we need to in order to feel empathy, but also to be removed enough that we can help. This was very difficult for me in setting boundaries. I also was experiencing precognition and intuition on a very heightened level since my near death experience. I had had a little bit of this actually in my intuitive life before my NDE. But after my NDE, this really took off like gangbusters. I really don't know how else to describe it. I was having a lot of precognitions, aware of a lot of synchronicities. I would often know what a client was going to come in the office and tell me about. I would know about the experience before they even had made the appointment to come and see me. It was a lot more information than I was used to processing. And I didn't quite know what to do with it. Uh, it didn't frighten me. It was just overwhelming at that point, and I needed help to process that. I saw it as a gift, but it was again just very put me off balance for quite a while. And I knew that I was a wounded healer at that point. I wanted to embrace that concept uh, because I think it's a really wonderful one, in that our own wounds can be used as a bridge to others. But I was at this point feeling more wounded than I was a healer. And although the concept was nice, I really felt I needed to really take care of myself in a much more serious way if I was going to continue seeing clients. On a personal level, I had emotional sensitivity in the same way that I just described it to you in the therapy room. In all of my family relationships, my friendships, even being out in nature, every part of me was so sensitive. I felt like a sponge. To say I was an empath was really an understatement. I felt no sense of separation between myself and somebody else's experience, uh, something I was experiencing in nature, anything. And it was really a new way of being in the world. I felt a sense of longing for home. I was very happy to be back here with my family and my loved ones. I was still pinching myself every morning, being grateful that I had survived this horrific medical event. But I still felt a sense of really homesickness. I felt somehow that where I had come from in my near death experience was my true home. And there were many days I just wanted to go back there. There were changes in my social support network. Uh, friends that I had had for years were frightened by the experience that I had. They didn't want to ask too many questions. They wanted to support me, but I couldn't talk about the profound experience I had had, told me that I was different. My relationships just changed. I felt a very shifting sense of priorities and purpose. The things that were so important to me before my near death experience, all of a sudden, just were not anymore. They were trivial. They really didn't get my attention at all. And I felt a real clarity about wanting to focus on the mission that I had been given in my near-death experience. And this was hard on a daily basis to integrate when life happens and one has to cook dinner and get kids ready for school and attend proms with your kids as a chaperone, or have a professional life and carry on as if it was business as usual, when for me it didn't really feel like business as usual. And that spilled over into my religion. Also, I was raised as a Catholic, and all of a sudden, although I still felt connected as a Catholic to my that organized religion, it felt so small and insignificant compared to the vastness of the experience that I had just come from. It felt like something that I needed here, but certainly there, wherever there was, religion was not necessary because it was so far beyond organized religion. And that set up some real challenges for me as a Catholic that I had to work through. The relationship challenges I mentioned and the paranormal after effects were continuing to build momentum, the precognition, the intuition, um, the synchronicities that were happening in my life that were probably there all along, but all of a sudden I recognized them and felt that they were there for a purpose. This was reaching critical mass, and every time I thought it could not get any more intense, this would continue to grow. I decided that I really needed to seek mental health care and help. And I needed help for both my professional and personal challenges, for how I could embrace the concept of being a wounded healer and using that as a positive force in my life as a healthcare professional. I wanted to locate a practitioner who had experience with near-death experiences or spiritually transformative experiences. This proved to be very, very difficult. I wanted somebody who was open to the normal in the paranormal, if that made any sense at all. Didn't want anybody telling me I was crazy because I was sensing what was going to happen, or I knew something before somebody was saying it, or I recognized a synchronicity, which had no connection to somebody else who was observing that. And I didn't want my near-death experience pathologized. I did not want to be labeled neurotic, psychotic, dissociative. Oh, yeah, you left your body, you're splitting. Uh, some axis 2 diagnosis, you're histrionic, you're dramatic, any label that you could imagine. This was like nails on a blackboard for me. I just really did not want that to happen, and I feared that. And so I encountered a lot of obstacles in seeking care for what was really the most transformative experience of my entire life. What were the obstacles I encountered? Well, the first one really was fear, my own fear, my fear of disclosure, being labeled, as I just said a minute ago, having my experience being pathologized, and the fear that I was experiencing from others. When I would call healthcare professionals just to do a screening call and tell them a little bit about my experience, they would say, oh, well, you had a sudden cardiac arrest and nobody knows why you had that. Are you okay now? Is that going to happen in my office? Well, my calendar's a little full right now. I'm not so sure I can take you in. And, um, you know, what are you talking about? A spiritually transformative experience? Well, I don't really have the background for that. Maybe you should see a spiritual advisor, a priest, or a rabbi. My colleagues tried to be supportive, but it was hard to disclose even to them. I would just tell a little bit about my experience. And remember, a very trusted colleague said to me when I was telling her about the experience, whatever you do, Deb, don't talk about that in therapy. Even if a patient asks you that directly, don't talk about it. Certainly don't glorify it, because you might be, might push somebody over the edge. That might be that one thing that they might need to hear that might decide, okay, that's the exit ramp for me. So she was trying to support me, but it was also very discouraging. Um, my healthcare team saw this through a very pathological lens, which I'll tell you about in a minute. The responses were very invalidating. I found very limited professional resources for what I was looking for. The religious resources were certainly not there in my own faith tradition of Catholicism. There was no formal position on near-death experiences by the Catholic Church. There still isn't. Um, I wanted to consult spiritual practitioners, a medium or a psychic or a shaman, but I had a very traditional training in Western medicine, and I didn't have the tools to really evaluate their credentials. I had no idea, no place. Where does one look to evaluate the CV of a psychic or a medium or a shaman? I really didn't even know how to go about that, but sensed that a spiritual practitioner would also be helpful for me. And there were financial obstacles. Face it, many of these alternative practitioners are not covered by insurance. In fact, unless one has a billable DSM diagnosis, which I didn't seem to fit into, regular psychotherapy or just basic psychotherapy was probably not going to be reimbursed by a third party. And at the rates that people were charging in my area, there was no way I could afford a lot of these therapies. My husband had many medical bills that year. My autistic son did. We were still dealing with medical bills from my father's illness and passing. It was tremendously stressful for us, and this was an obstacle for me in seeking help. Here are some examples of what those obstacles looked like. Well, from the medical team. Well, Deb, you had severe brain damage, clearly you had a brain injury, and that explains it all. Of course, we can't explain how that injury has healed itself now. We have no explanation for that, but we know that you had it. So I had it. I don't have it now, but yet my experience is still very real to me. Well, maybe you had a history of prior mental health problems. Have you ever seen a mental health care professional? Were you ever depressed? Were you ever anxious? I knew what people were asking me, and it was very, very discouraging for me. Um, I'm not really qualified to treat this, Deb. I'm sorry. I wish I could, but I really have no experience with NDEs or mystical experiences. And what exactly do you mean by paranormal? That's really not something that we treat in this practice. Focus on your cardiac health. Focus on the physical. That's what you need right now. That's your priority. Listen, you almost died. You were traumatized by that. We all fear death. And so you're just like the rest of us. You were afraid of death. And so you kind of imagined this wonderful experience about how the soul lives on so that you don't have to deal with your fear of death. It was just wishful thinking, Deb. This, of course, was ridiculous for me to hear. I knew where it was coming from. And prior to my NDE, I might have even related to that. But the paradox was, after my NDE, I had absolutely no fear of death. Zero. I still don't. I never will again. No fear of death. So that made no sense to me. From a very well-meaning priest, would you like to receive the sacrament of confession or the last rites? Well, these are the only tools he had in his toolbox. I understand he was trying to help. Did I want to receive the last rites? Absolutely not. I felt like I had been reborn and was so happy to be alive. I was so much, I was filled with more life energy than I ever had been before, and didn't feel like I was a candidate for last rites. Didn't want to go to confession because I didn't know if he was implying that I was fabricating this experience, but there was nothing about my experience that was untrue. And I had no desire to confess it because it was not fabricated. It was completely my truth. You're not the same person you used to be. Hopefully, you'll be back to normal soon. I heard this from a lot of friends and family members. It's probably best not to tell too many colleagues. This is what I heard from many of the colleagues I tried to consult with about finding help. It might not be the best thing for your professional life. And your insurance won't pay for this. I'd be happy to help you. My rates start at $250 an hour and up. And of course, as I mentioned, even for very enticing opportunities to see spiritual practitioners and alternative healers, my budget for this was very limited at that point due to my medical bills. What did I need? What I needed was somebody who had what I call NDE cultural competence, somebody who had worked with people who had had exceptional experiences, who had had near-death experiences, somebody who was baseline counseling, strategies, right? Supportive, listening, compassionate, who wasn't going to judge me, who was going to listen and authentically respond and validate my experience. This was probably at the core of really what I needed. I needed somebody who saw me holistically, who saw how this experience impacted me in body, mind, and spirit. Somebody who was spiritual and not religious, didn't need dogma or organized religion. I needed somebody who was looking at life through a spiritual lens and looking at my experience and me through a metaphysical or spiritual lens. Somebody who I could trust. I knew that I needed a therapeutic alliance that I could depend on for the long haul. I knew that this was not going to fit into a model of brief psychotherapy and brief counseling. I knew that this is something I was going to have to work with for a while, if not my whole life, to integrate and to grow spiritually from. And I needed help with that. How do I integrate this experience, this exceptional life experience, into my new normal? I needed resources, group support. What can I read? What can I use? Who can I talk to? I needed somebody to help me find meaning and purpose in this experience. I did not want this to be seen as something that happened to me that I was going to move on from. I wanted to use this and use this as a positive force in my life. And most of all, I needed balance. I really needed somebody to kind of take all of these ingredients and help me find balance on any given day, because I still felt that sense of having one foot here and one foot there and feeling kind of spiritually seasick is kind of one of the terms that I've used to describe it. This is a table that I think captures a lot of what I got, a lot of what I didn't need, and a lot of what I wanted. This is a tool that was devised by Dr. Janice Holden, who is a counselor, had a long career as a counselor, is a professor emeritus rather at the University of North Texas, and happens to be the current president of IANS. And I think she captures this so nicely. At the top of the table, she uses the letters for NDE, a little out of order, but you get the idea. N in column 2 for near, 1 don't, D, and 3 affect. So NDE. Again, a little out of order, but very powerful. So for example, in the first column, what the counselor should not do. Don't do these things. And I was getting a lot of these things. Number 2, what to do instead. And 3, what therapeutic effect do you want to have? Or would you have or hope to have? For example, the 4th from the bottom, disbelieve. Well, don't disbelieve the experiencer. Instead, try to normalize or naturalize their experience, because you would hope that this would help them to feel equalized, endorsed, empowered. Uh, don't demonize it, certainly, second from the bottom, or pathologize it, or give it a diagnosis or label it. Instead, try to help navigate through it, through the normality of the experience, and help to equip that experiencer and enlighten them into how this experience can be used. So I love this table because I think this summarizes things so very nicely. How did I finally find help? How did I find all those do's that I needed? Well, it was basically a self-help recipe. It was clear to me after looking around and getting a lot of those don'ts that I was going to have to devise rather a self-care plan for myself, a recipe that would work for me. The first thing I did was I went to support groups from the International Association of Near-Death Studies, and almost immediately when I started listening only without saying anything in the first several meetings, actually for a long time in the meetings, just listening to the experience of others, I received instant validation. I heard other experiences like mine, and even if they were different than mine, they were so similar and had so many common elements. I knew then, okay, I really did not imagine this. I knew I didn't, but to hear somebody else describe your experience in their own words, in their own experience, was just tremendously powerful. One of the most powerful things about group and group experience. Bibliotherapy, I read everything I could get my hands on about near-death experiences, mystical experiences, exceptional human experiences. I pulled out all of my books that I had from the 70s, Raymond Moody's pioneering book, Life After Life, from the early 70s, the early work of Bruce Grayson and Ken Ring. I pulled them all down and kind of dusted them off and just dove into all of them and read them cover to cover again and again. They were tremendously healing for me. I was reading them this time with very new eyes, the eyes of an experiencer. I started networking with other experiencers. This was tremendously helpful for me in terms of social support. I created a new spiritual path for myself that involved meditation, daily meditation practice, attending a lot of workshops on spiritual experiences, near-death experiences, all things spiritual. This was very sustaining and supportive for me. And the meditation was probably one of the core strategies that helped me. Everything else seemed to revolve around my meditation. And that meditation was the center for me. It grounded me. It helped me to experience both the there and the here simultaneously, if that makes any sense. And I felt a tremendous sense of peace about that. Alternative therapies that I did finally choose as I was able to afford them included some Reiki work, acupuncture, which really helped me to feel balanced, and massage therapy. And I finally found a wonderful Jungian therapist. I knew from my doctoral training that Carl Jung himself had a near-death experience. And I was always a fan of his work, although I really did not have Jungian training. And I knew her from my doctoral internship, and she was amazing. She saw my experience from the beginning through a spiritual lens. She helped me to take all these other parts of this recipe that I had created for myself and tweak them on any given week. Okay, do you need to do more reading this week? Or are you attending a support group? Or how's your meditation practice going? What are you focusing on? Or how are things going in your social support network? So she helped me in a collaborative way. We were a team in working with this recipe that I had created for myself, and it also in helping me find some other alternative practitioners that were very, very helpful to me. I found, in addition, a pastoral counselor who happened to be a Catholic priest who was prepared he was a master's level counselor. He was doing counseling, and he was a very unconventional Catholic priest, and just a wonderful human being. He embraced my experience from the beginning spiritually. There was no labeling, there was no negativity, there was no talk of confession or last rites. He really helped me to embrace the experience myself and to make spiritual meaning out of the experience. He even wrote about my experience in one of the columns of our local newspaper, in which he was a regular contributor. He remains a very close friend of mine today. I had a good friend who was a rabbi, and our relationship kind of changed after my near-death experience. We began to connect more on a spiritual level. She was and is more connected to Judaic mysticism and Kabbalah. And this was also very, very helpful for me. It was not my roots in terms of my own faith tradition, but it was tremendously wonderful for me because so many of the concepts helped me to make spiritual meaning out of not only the experience, but how I was to use it in this lifetime. And my social support network broadened because of all of this, and it really helped to sustain me. Well, what are the takeaways from my experience and my search for help? The first is that an extraordinary human experience, such as mine, is certainly extraordinary and profoundly transformational. That's really the key word that I would describe for the experience, or that I would use rather. It just is transformational in no other way, that no other human experience I certainly had in this human body transformed me. And therefore, an experiencer who has undergone this has exceptional needs for validation, empathy, a certain type of confidence, somebody who's open to anomalous experiences. And so the exceptional needs don't always mesh very well with traditional ways of helping or traditional therapies and interventions. We lack the tools, I believe, and the worldview, and certainly the research base that is needed to address these exceptional needs. And we need to get much, much better at this through workshops like this. Experiencers want to use their transformative experiences in positive ways in their life. They don't want to forget them. Whatever they were, even if it wasn't a near-death experience, the experiencer wants to grow, to use this as a source of strength, because they're never the same after that. It is a new normal. They don't want to be the same. And so if we don't find ways to holistically support experiencers, body, mind, and soul and spirit, we really are not helping. And individuals like myself incur the risk of really having very poor mental health outcomes and challenges with daily functioning, just trying to make sense of themselves in the new normal. And this is something that we need to get much better at. And I believe that we are getting there. Thank you for your attention. And I appreciate the questions that I know will come. And now we will go to the question and answer session. Thank you so much.